indeed, after the COVID-19 and after all the discussion and the work that have been done on social protection in general and social protection for persons with disabilities, now we all realize the importance of social protection for persons with disabilities, in particular, given that persons with disabilities have less opportunities for employment and economic development due to the barriers and discrimination they face in their life. They also face additional costs related to their disabilities, such as assistive technology, assistive devices, human assistance they required, and so on, beside the additional cost of healthcare related to persons with disabilities. So realizing the importance of social protection for persons with disabilities, now we need to move ahead to think about how we can provide a package of support for persons with disabilities that not only includes them as a part of the target audience or target beneficiaries, rather we ensure the package of support that we provided has the outcome and push for the inclusion and more participation for persons with disabilities. So the role of social protection here is really to facilitate the participation and inclusion of persons with disabilities. One of the key interventions should be in this regard cash transfer, but indeed cash transfer, despite it's so important for persons with disabilities, should not be as a standalone intervention. We need to have a comprehensive package that considers other diverse requirements by persons with disabilities to be included and participated, such as human assistance support, assistive devices, considering the disability-related costs in general, and healthcare. So also in the region here, we experience an advancement on the inclusion of persons with disabilities in different aspect of social protection. However, there are still some opening questions, and there are some challenges that we need together to think about. I'm not going to speak further because we have a wonderful panel today. We will start setting the scene and talking about the state of play of the social protection in the region with Alexander Akkod, a social specialist focusing on social protection and disability with UNICEF headquarters. We will have with him together Ms. Joanna from Asian Development Bank, ADB. She is a consultant on disability. Together, they will share with us a little bit about the situation in the region and how the social protection should be in the context of persons with disabilities. Following that, we will have Ms. Aldi. She is the head of Bureau of Policy Planning and Development with the Ministry of Social Welfare and Development in the Philippines, and will be followed by Resimi, the Secretary General of the National Social Protection Council in Cambodia. And then we will have Mr. Munirajo, the director and the head of the Institution for Transforming India. And finally, we will have Fatino. She is office manager with the National Association of Persons with Disabilities in Samoa. So we will have a diverse discussion, sharing about different things, sharing about the overall approach, sharing about assistive technology, disability assessment, disability-related cost, and consultation with persons with disabilities and their organization. Before we start the discussion, I will remind you all if you can use the Q&A option in the app, so you can put some question, and also by the end, we will try to have some space for in-person questions. Alexandra and Joanna, I welcome you to the stage to share about, to set the scene for the discussion.
Thank you very much, Alradi, and thanks to all of you to be here today in this session. I'm just waiting for the slides. Yes, thank you very much. So I will start by reminding all of us. A few years ago, the ILO, UNICEF, the International Disability Alliance, and many others adopted a joint statement towards inclusive social protection for participation of persons with disability. What did we do then? Basically, taking the Convention on the Rights of Persons with Disabilities and trying to understand what that means in terms of social protection systems. From there, we move in the last 4 years trying to understand what does that mean exactly in terms of transforming system. What do we need to change to make social protection not only inclusive of persons with disability, but also promoting inclusion of persons with disabilities. The story of persons with disabilities and social protection is very easy. They spend more to achieve the same standard of living and participation than others, and they earn less. And we see that across country and across region. And we will hear today from the Philippines about methodology on how we understand better those costs which we need to be able to design our social protection intervention. But one thing that is striking, and we heard this morning the Deputy Minister from Georgia talking comprehensively about the support for persons with disabilities, and we did there with stakeholders a study on cost of disability for children. And what really came out is one size does not fit all. Wide difference of cost faced in terms of rehabilitation, transportation, assistive technology, human assistance, and so on, for different groups of children with disability. And we see that across country where we do those studies, also for adults with disabilities. So overall, we need policies that remove barrier, because the more barrier there is in the environment, the more cost people face, and we need to provide support to help persons with disability overcoming those barriers. And when we do so, we really need to take into consideration the diversity of persons with disabilities. So progressively, what social protection system should do? The first element, which is at the core of social protection system, the Resolution 202 and different conventions from the ILO, is income security. But there are often confusion of what that means. And many countries still focus their social protection system with persons with disability on the notion of incapacity to work. And when we do so, we are actually sending a message to society saying persons with disability cannot contribute. So yes, persons with disability are more likely to be unemployed, have more difficulty to find a job and to be in position to work, but it doesn't mean that they cannot work. And this is a very important message, and social protection should actually contribute to economic empowerment and not prevent it. Another critical element which has been mentioned is coverage of healthcare costs, including early intervention for children with disability in young age, as well as rehabilitation and assistive device. And of course, coverage of disability-related costs. And when we do so, we always need to think, does the program, the scheme, the combination of schemes contribute to inclusion of persons with disabilities? Too often we have, and whether it's old age, working age, or young children, residential institutions seems to be a viable option, which is in the contradiction with the Convention on the Rights of Persons with Disabilities. So what we see from countries that have tried, and again, the ministry from Georgia really clarified that, we need combination of schemes. One cash transfer, the one disability allowance will not make the cut. We need combination. And we see that in the region, whether it's Thailand, Fiji, and other countries, combining different benefits between the health insurance, cash transfer, and still difficult, but more and more, attention to care and support services. But at the core of all this, there is one question. How do we know who needs what? And we have talked this morning about the necessity to change the way we assess disability and how we should focus not only on the impairment that people have, but also the support needs that they have. And we need to use this information not only to decide, are you a person with disability, yes or no? Do you have a disability card, yes or no? But to do case management, to basically try to make the most of programs that are delivered by government, but also by non-government organizations within a certain community. And we need also data to plan. How many people with disability will need personal assistance? How many persons with disability need sign language interpreters? How many need assistive technology, etc.? Most countries do not have those information, neither statistically nor administratively. And modifying the way we assess disability for the purpose of social protection can really solve this issue. And I will finish by highlighting key elements around that, which is the need to build disability assessment mechanisms that are really accessible. Too often, we will ask the medical certificate by the accredited doctor. They need not that many. And in most countries, this creates barriers and exclude a lot of people. So what we want is to build systems that are easily accessible everywhere in the country. We heard about Maldives, small island development states spread. We heard about Nepal, etc., etc. So how do we ensure that this is accessible, as comprehensive as possible, but also reliable, so that the entire set of entities that are supposed to deliver benefit for persons with disability trust the system? And with those words, I will give the floor to Joe to give us an overview of the situation thanks to the SPI.
Thank you very much. I'm going to just very briefly touch on the results from the ADB Social Protection Indicator for 2018, because it was the first time that ADB actually conducted analysis that was disability sensitive. So we looked at social protection expenditures since 2009, and tried to understand, what they were in relation to people with disabilities. This is for Asia, and you can see that the orange bar is actually the largest proportion of social protection expenditure in Asia, and that is social insurance. And within that, a tiny fraction of people with disabilities who are benefiting from that, because it's a contributory form of social protection, and many people with disabilities are not in employment where this is taking place. So most of the measures for them are the green line, which is social assistance. It has gone up since 2009, only slightly in Asia, but interestingly, in the Pacific, this is the Pacific, you can see there's quite a sharp increase in recent years. And this is partly because several Pacific Island states have been introducing targeted disability allowances. In some cases, universal allowances, meaning they're not means tested. So this is an interesting trend. And one of the things I think to note is that although there is this very sort of slight increase, the starting point was extremely low in terms of social protection. So there is still a long way to go. You can't probably read this, but that's okay, because you can see the reports for Asia and Pacific online on the ADB site. Please do have a look. There's a whole chapter dedicated to disability inclusion, as well as chapters on gender, poverty, and other aspects, COVID. But one of the things that this, I hope, illustrates, the blue bars are the proportion of expenditure on people with disabilities amongst the overall social protection expenditure. And it is very low. We can see that in many countries it's tiny. And to some extent we might expect that, because the proportion of people with disabilities in the population is lower than the whole population. But it is something we need to understand better, I think. Some of these higher blocks, many of those are Central Asian countries, Uzbekistan, Kazakhstan, Azerbaijan, which have inherited a system of services and also different types of benefits for people with disabilities. Although we heard today about Georgia, which is also one of the slightly higher spenders here. how they are transforming that system away from institutional care for people with disabilities towards community-based services, cash allowances, universal cash allowances, and so on. So a more diversified package. The sort of main takeaways from the SPI this time round, I think, were, first of all, that disability prevalence tends to be in many countries based on the number of people who are actually registered with disabilities. And Alex already mentioned, how this is a challenge, and registered people with disabilities tends to undercount the actual number of people who have either a lot of difficulty or cannot do at all some kind of functioning. So there are issues around calculating disability prevalence that need to be addressed, which would make it easier to understand the situation. And to plan policies, programs, and to understand, what we need to do to really achieve inclusion as a result of social protection. The second is really, it's clear that people with disability are amongst the poorest in the region, in both Pacific and Asia, that disability increases with age, and we've heard today about aging in this region. There tend to be more women with disabilities in old age than men, and all of these have implications for social protection and the policies that we adopt. We've heard a bit from Alex, and we'll hear more, I think, about the extra cost of disability, which means that both disability allowances and access to other types of social protection really must take into account the extra costs of disability. We know there's a big variation depending on each individual's situation, each individual's disability and difficulty in functioning, and our systems need to be sensitive to that as well. There's a very big need to improve data on prevalence, putting Washington Group questions into the census, which has been done pretty much in all the Pacific countries, and perhaps half, I don't know, 2/3 of the Asia countries, but also in social registers. It is useful to be able to understand the extent to which people with disabilities are accessing or not able to access targeted social assistance, for example, or other poverty alleviation measures, and also labor market measures. I didn't comment, but in the previous slide on the SPI, labor market measures are bumping along at the bottom, almost no change, very low. And one way of increasing the labor market might actually be to support people with disabilities into the labor market. So something we need to be thinking about in terms of disability inclusion. So I will stop there. Thank you very much, and looking forward back to you.
Thank you so much, Alex and Joanna. And indeed, a lot of things need to be discussed. And let me, at this stage, pick the word disability-related cost. So since we are talking about how, let us see how much the disability-related cost for raising children with disabilities and how we can estimate or calculate that. For this, I will have Rodora Eldi from Philippines to share with us about the studies that they have done recently on the cost of disability-related cost to raise the children with disabilities in Philippines. The mic is yours.
Thank you so much. So good afternoon, everyone. So I am pleased to share with you the results of the study that we did on the cost of raising children with disabilities. So this study, together, DSWD, the Department of Social Welfare and Development, together with UNICEF, commissioned this study. And the study was with the support of the Department of Foreign Affairs and Trade Australia. And this study was undertaken by the Oxford Public Policy Management. Okay. So I'll be quickly presenting to you the objectives and expected use of the study and the research design, and I'll focus more on the key messages or the findings of the study and its policy implications. Okay. The key objective of this study is to produce an estimate of the extra cost faced by households with children with disabilities in order to inform possible policy responses that would improve inclusion to social protection measures. So there are two main areas of interest. One is the assessment of the current situation of children with disabilities, so we can understand really how much is the cost based on the welfare levels, types of disabilities, household composition, and service provision. Then the second area of interest is the possible policy and program implications. So we want to understand the need for developing new services or improve the current services. We would like to see if there's a possibility of addressing some of the extra costs through a disability allowance or the possibility to provide extra support to children with disabilities in the existing social protection programs. So what you see on the screen is the conceptual framework of the study. So fundamental to the methodology that the study proposed is the measurement of the household standard of living so that extra costs can be assessed comparing households of the same welfare level. So I won't be dealing too much on the conceptual framework, but rather on the findings. In the research design, so we did consultations, focus group discussions. We also did sample survey and households in-depth interviews to 2,753 households covering 240 cities and municipalities in the Philippines. So what are the findings? First, is the size. So while the survey is not a disability prevalence, because of the size of the sample, we were able to provide an estimate on the number of children with disability ID card. So there are about 325,000 children with a disability ID card, or about 0.8% of all children. So this reveals that only 1 out of 5 children with disabilities has a disability ID card in the Philippines. The sample also provides us an estimate of the percentage of children with functional difficulties in the country. So we use the Washington Group or UNICEF module on functioning, and then the Washington Group on Disability Statistics has developed question sets based on the functioning approach that ask about the difficulties an individual may have doing everyday activities. So there are about 3.5% or 1.27 million of children aged 2 to 17 that have moderate or severe functional difficulty, and increases to 8.5% or 3.07 million when mild functional difficulties are included. So the second key message is the disadvantage of children with disability card to access basic services and meeting the fundamental rights. So the findings emphasize the children with a disability card and their families are in a situation of systemic disadvantage across many fundamental rights. But of course, the group most deprived is the children with disabilities who do not possess a disability card. So the next slide shows the access to services among children with functional difficulties with or without possession of a disability ID card. So among children with functional difficulties, health insurance coverage is lowest among those without disability card at 60.9%. And to further investigate access to health care, we asked whether they had to forego necessary treatment or consultation in the last 6 months. So same figure shows that those with disability card have much higher foregone needs, but this is also true for those with functional difficulties and without card. In terms of education enrollment and completed level of education among 5 to 17-year-old children, non-enrollment tends to be higher among children with functional disabilities with or without ID card. And availability of practical help outside the family can be considered an indicator of support from the community. And the studies show that the percentage of households who have no one to ask for practical help are high among households with functional difficulties for both with or without disability card. In terms of consumption expenditure gap among children with and without disabilities, the patterns are very different for families with children with disabilities, and health expenditure share on total expenditure is 3 times higher compared to other households with children. So the disability card helps households who make use of it to reduce cost, but its subsidy is mostly received by the better off. As mentioned earlier, to have a card, you have to get a medical certificate and pay for it before you can even apply for the card and enjoy the benefits and privileges that comes with the disability card. This table shows consumption patterns for selected items among households across different analytical groups. So households with the disability ID card have distinctively different spending patterns. Most noticeably, a much higher percentage of their budget is spent for health, but also education and relatively less for food. Households with cards spend a higher percentage of their budget on health, 3 times more, but also on education, even though there is a higher non-enrollment. So merging the information on ownership and use of disability card in the study, it computed the subsidy received by each household and how this is distributed across consumption quintiles. So this figure shows disability card subsidy distribution, where it is clear how most benefits go to the upper part of the distribution. Better off households, of course, because they can get a disability card, so they have more access to the concession card, and of course, they get to enjoy the privileges and benefits. So subsidy is clearly skewed towards the better off. In terms of extra cost, how much is it really in the Philippine context? There is a child with disability in the Philippines needs an expenditure that is 40% to 80% higher than other children without disabilities. Accounting for the extra costs means that poverty rates for children with disabilities are 50% higher than those of other children. This figure shows the differences in expenditures for couples with 2 children. A child with disability needs an expenditure that is 40 to 80% higher than other children. A child with a mild disability needs an expenditure that is 40% higher than other children. And for children with moderate or severe disabilities, they need an expenditure that is 80% higher than other children. And I would like to note that some of the unmet minimum needs that were noted in the studies are: 1, being enrolled in school; 2, not declaring to have foregone health visits or treatments; at least 1 household member with health insurance; and meeting the acceptable standard for the food consumption score; does not report hunger episodes; and meets minimum water and sanitation facilities; and having adequate rights to live in their dwelling. So actually, this is very disheartening to hear the results. And of course, most importantly, what are the implications of the study? So there's a need to increase awareness in terms of disability registration, and we have to develop multiple entry and referral systems for early detection of disability. So we really need to create actually there's an ongoing discussion in the Philippines on how are we going to improve the national database that would help us really plan for services for children with disabilities. And the benefit from disability registration should be for everyone by increasing services and making disability card worthwhile. I think in the suggestion, it should really be free for all, free for everyone. So though we have the Magna Carta for the persons with disabilities, there is no mention that the disability card is really for free. And then extra costs need to be addressed with disability allowance that we could at least cover some of the extra costs. And we are recommending to adjust the eligibility assessment and financial support to children with disabilities in programs that are means tested, is specifically our conditional cash transfer program. So zooming in on the policy discussions, these are some of the concrete actions that we have taken in order to utilize the results of the study. So we are continuously lobbying and advocating for the passage of a disability allowance, disability support allowance. So we have been presenting the recommendations and discussing with the Congressional Policy and Budget Research Division of the this year, and the Senate Ways and Means Committee to finally enact a bill on disability support allowance. And of course, as presented earlier, we have to actually fully implement what is in the Magna Carta for persons with disabilities. So we are also working or exploring how can we provide added support to children with disabilities who are already enrolled in our Pantawid Pamilya program. So we're looking at top-up grants, or how do we actually enroll them actually without, because there are certain conditions before they can receive the grant. So we're looking at how can children with disabilities waive these certain conditions so they become eligible for cash grants. So we're working on it, trying to look for means on how are we going to do it. So this ends my presentation, and hoping that we will have more discussion on how are we going to proceed. Thank you.
Thank you so much, Aldi. Indeed, a lot of interesting point to be taken. So now we saw how much, like it's really huge, from 40 to 80%. And also, we need to consider that when we are designing a package on social protection. We also saw how diverse support requirement from health to education to assistive technology and so on. And this diversity also impact, the amount of support required. So no one side could fit all. We need to consider it here as well. And also, just to highlight, there are different methodologies to conduct such studies. This is one of the methodologies that has been conducted here. However, there could be other methodology available as well. One of the also key interesting points about the disability card and how important it is, because the disability card, disability assessment and determination is a gateway to access social protection for disability-specific programs. So the question would be how to ensure this gateway is accessible, is comprehensive, reliable, available, and in line with the human rights-based approach to disability. To answer this question, I will go to Mr. Risemi, as the head of the Social Protection Council in Cambodia, to share about their approach on disability assessment towards inclusive social protection. The floor is yours, and you have 10 minutes.
Thank you. Hello, everyone. I hope you are not sleepy after lunch. So I have 12 minutes, so I need to rush in some part of the presentation, so bear with me. So let me start. Okay. So let me start by telling you a little bit about Cambodia's social protection system. So in Cambodia, the social protection system development is guided by a policy framework, the National Social Protection Policy Framework 2015-2026. So with this framework, a national council is established in late 2018, the National Social Protection Council. And this council is the highest policy making and who guide the development and the reform in the social protection in Cambodia. So with this establishment, recently, since 2019, the social protection system in Cambodia has developed rapidly. Many programs has put in place. A flagship program, CCT, for pregnant women and children under 2 was put in place. And there is an expansion of coverage and also increase in social protection expenditure in the country. So with this framework, it also pointing out the needs to acknowledge the special rights of persons with disability and to go forward into working toward to develop a social protection which is disability inclusive. So with this policy framework, it pointing out two main points that the government needs to do. The first one is to review and reform the identification of persons with disability in the country. And the second one is to review the social protection benefit for persons with disability. And these 2 points would be the main of this presentation. So before going to show you about the social and right-based disability identification mechanism, I would like to ask all of you in the room to imagine the life of Mrs. Bopa. So Miss Bopa, I call her Bopa. She's a single mother in a rural Cambodia who is having a disability with 2 children, also have disability. She goes from her home, spending 30 minutes driving to the commune office, right? So this is in the rural area, hoping to access to social protection benefit, which is a cash transfer. Then when she arrived, she was rejected and was informed that she is not eligible to receive the cash transfer. Why? Because she was not identified and was not having an ID, disability ID. This is the real situation in Cambodia back before 2019. And the life of Ms. Bopa represents many lives in many lives of persons with disability in the country before, because we do not have a national identification system or ID, right? So I think in 2020, with the support from UNICEF, EU, and also some contribution from Access Program funded by DFAT, the government has designed a identification system called social and right-based identification mechanism in Cambodia, which is a very simplified questionnaires, which can be done, I think, in average 15 to 20 minutes in the view. It's a mobile app, easy to use, and it's digitalized. And with that, the government formalized the mechanism through a sub-degree in 2023, recently, early this year, which, formalized this mechanism saying this is the national identification mechanism for persons with disability, and we will use this for providing social protection as well as social welfare services to persons with disability nationwide. And we will giving an ID card so that persons with disability can use this card to access a lot of benefit provided by the government, but also private sectors. So this social right-based identification mechanism, we use right-based approach, but also combination of medical-based and also medical functional limitation, but also social model of disability, so that when identified, he or she is not a person with disability will not be excluded, and he or she can benefit equally from the benefit provided. So this is a very simplified identification mechanism, and it's a mobile-based app, and there is a DMIS, disability MIS system at the back end as a database, and this app is used nationwide, right, in all communes in the country. Now, if you go to a commune office and you request for an identification, they will take out their phone and start interviewing you. For 15 minutes, he or she will be identified whether he or she is a person with disability or not, and which disability and all. So I will go into detail about the types. So there are 5 types or 5 categories of disability for this identification mechanism. Physical, sensory, intellectual, mental, and others. So this others is huge, right? There are many other types of disability. And it's divided into 3 severity, the most severe, immediate, and mild. And in this mechanism, identification mechanism, we have these social indicators, the support needs, the access to necessary document, the support needs so that they can move around and enjoy equal access to all public services. So all these indicators embedded in the questionnaire, and when it's identified, they are, we hope, the government hope, that not many persons with disability are excluded. So this is the process, mobile app, and then the data, after interview, the data. Why mobile app? Because everyone have a smartphone, and then they can take their smartphone and also go to the house of person with disability who are not able to move to or mobile to the commune. And then the data transfer to the provincial office, DMIS, they can access through the system, and then it will go to the Ministry of Social Affairs, Veteran and Youth Rehabilitation to approve, and then the card is printed. You can see in the slides, there's a real, actual image of the disability card, right? So this DMIS, since now we have the system, this system also connected to ID pool, which is another identification mechanism to identify poor households so that they can access to social assistance program. And all these systems are connected to cash transfer MIS system. So now it has been done digitally, so person with disability can receive cash transfer to their account, and they don't need to move to the commune. So what is the progress? Right now we have in the DMIS system about more than 250,000 persons with disability. So this is through a very first campaign since 2021 until now, and we have this amount of persons with disability identified and receiving ID. And the government plans to have another campaign starting this year, so that they can register more persons with disability in the country. Why campaign? Because this identification is just launch. So not many people know about this. So we need to do campaign, and later on, this identification will be on a not campaign basis, but on demand basis, so that person with disability can, or the family, or the parents, or the guidance, or the NGO can apply for an identification of and receiving a card for a person with disability. So after receiving the ID, this is the social benefits that the government has provided to persons with disability. If you see on the left side, this is the current benefit that the government provides. As you can see, the coverage is still small for disability allowance. And during COVID-19, the government launched a shock responsive social assistance program, cash transfer for COVID-19 to poor and vulnerable households, provide additional cash transfer to more than 65,000 persons with disability within the household. Actually, this program reached 700,000 households, poor households, equivalent to 2.8 million individuals. And recently, in 2023, the government also launched another shock response cash transfer for at-risk households. These are near poor households, and provide cash transfer to those households, including additional 6,000 persons with disability in at-risk household. So this is the current one, and you can see the coverage is small, limited, because the identification system was not there yet. But now, since we have this identification system and data and information of persons with disability in hand, the government has put forth, I can say, a reform, a development, expansion, social protection for persons with disability. On the right side, you can see this four is only the main one I would like to show. The first one is the new policy framework will be put in place and will adopt life cycle approach, and disability is one of the life risks across the lifespan. So there will be a focus on disability and elderly. So with that, first step, the government has already going to launch this social health protection program through Health Equity Fund to near poor household, and those would include persons with disability within those households so that they can enjoy social health protection benefit. And the third one is family package. This is a integrated social assistance program, and person with disability is one of the specific cash transfer. There is a program within this family package, cash transfer for person with disability, in addition to a base income support for poor households. And last point, what I would like to make is that the all SOC responsive measure from social protection would include person with disability. So I think this is the last slides for my presentation. I would not go to the slide, but I want to ask all of you to recall the life of Ms. Bopa earlier. Now, she has been identified. She's having an ID, and she's receiving the cash transfer. She doesn't need to go to the commune anymore. Identified, the cash is transferred to her account or mobile agent where she can cash out next to her home. But again, this morning, Otis, she mentioned that cash is not enough. So I think I catch it very much. And I think that's the way forward that the government of Cambodia going to focus as well in the next stage after we develop this ID system, more social protection program benefit for persons with disability. And I think the next step would be to build a referral and linkage system to provide not just social protection benefit, but the other benefit, for example, social welfare benefit, rehabilitation, TVET, so that they can have livelihood. Then Bopa will also get those benefits, and we hope that Bopa would have better livelihood. So this is the end of my presentation. Thank you.
Thank you so much. Again, quite interesting point to be picked up. So about the model and the tool we use, we need not only to focus on the impairment and the medical condition, we need to consider the support required by persons with disabilities. We need to have the system integrated, so the other social protection intervention could take advantage of that. So it is great to see it is integrated already with the social registry. We need to make sure that the system is accessible across the country, so there is no a lot of back and forth. We need to make sure that it's reliable, because we need also to make sure that there is no use of the system, so there is no fraud. We need to make sure it's comprehensive enough to collect enough data that we can use beyond the assessment and beyond the determination and eligibility. And indeed, the question of the package will remain there, because as a person with disabilities myself, if you tell me go and do the disability assessment and get a disability card, the first question I will have in my mind, what is the package attached to that? Yeah, and it is a circle. If I don't have a card, I will not access the package. But if the package is not interactive and like fantastic one that could interact me, I will not go. Yeah, so let us think about like how we can go for a comprehensive package. And indeed, one of the key elements of the comprehensive package is assistive technology, assistive devices. So let us hear from India how they working on enhancing access to assistive technology for persons with disabilities. And I will give the floor to Minirajo.
Thank you, already. And my friend Sereng said, cash is not enough. This is the issue which all developing countries are facing. Of course, even in developed countries too, there are issues with regard to disability and with regard to elderly care and all those. Well, at the outset, I really congratulate Asian Development Bank for organizing such a wonderful event. and also bringing about 33 nations together to discuss and deliberate the issues of social protection and way forward and the gap areas too. Dear friends, participants, colleagues from various governments, civil society organizations and development partners, I thank Asian Development Bank for inviting me on behalf of Government of India as a speaker for presenting India's initiatives for the social security or social protection for the disability, inclusive social protection for disability is concerned. Well, we in India, we have a constitution which is adapted in 1950s to guide the governments at the national level as well as at the provincial level to formulate programs and interventions to see that all people are get their rights delivered. The fundamental right of the Constitution is which envisage, especially Article 15(1), enjoins the government not to discriminate against any citizens of India, and including the persons suffering from different disabilities or elderly population, or children, or gender-based discrimination, nothing. Article 39 that envisages the state shall in particular direct its policy towards securing that every citizens equally have the right to an adequate means to livelihood. Well, friends, there is directive principle of the state policy, Article 41, that provides for effective provision for securing the right to work and education, and also public assistance in cases of unemployment, old age, sickness, and disability. India is the first signatory to United Nations Convention on Rights of Persons with Disabilities. I'm glad that we have adapted, and of course, to make the right real, India is signatory to the Indian strategy too. Of course, India has developed the indicators for UN Sustainable Development Goals. Friends, way back in 1995, India came up with Rights of Persons with Disabilities Act. And we amended, considering all the recent developments in 2016, the Act outlines provisions for social security and social safeguards that provides reservation in public employment at the national government, provincial government, and in fact at the local government. There is reservation of 5% of the positions are filled from the different types of disabilities. We do provide financial assistance through National Social Assistance Program, and also Act envisages ensuring accessibility. We have come up with Accessible India campaign that provides accessibility in built-in infrastructure. We have converted all public buildings accessible to the persons with disabilities and of course, elderly population and others. And access to assistive technologies for persons with disabilities. India has come up with several national programs, and of course at the provincial level we do have the programs for providing assistive devices at free of cost to the needy people. Friends, we have a National Trust for Welfare of Persons with Autism, Cerebral Palsy and Mental Retardation and Multiple Disabilities that is envisaged under the Act that mandates both at the national as well as at the state level to provide health insurance for the autism and cerebral palsy, of course mental retardation and multiple disabled persons. This also provides for assistive devices and financial assistance for health and of course education. The Rehabilitation Council of India Act 1992 that regulates the special education and also provides for care services and training, because we know developed countries required many caregivers. There are no caregivers available. Of course, India has the younger generation population and we are the #1 country now in terms of population is concerned. And in that way, this care services is being provided technically. Well, friends, now we have a social protection programs in terms of direct cash transfers, and we have direct benefit transfer mode through Jandan, verified with Aadhaar, and direct bank accounts. We have linked and verified the biometric details of each and every individual in the country, that is mapped with the bank accounts and also the mobile number of the persons. And automatically we can verify the genuinity of the persons. Friends, as part of this social assistance program, we have a pension programs. That is, we have different pension programs, of course, widow pension programs, old age pension program. And also we have a pension program for the disabled that is saturated to cover all persons of disabilities who are belonging to poverty line and below. In addition to that, Government of India and also the state and national and provincial governments implements scholarship programs for the persons with disabilities, students with disabilities, the students pursuing pre-metric, post-metric, and also we have a national fellowships to pursue post-graduation and doctoral degrees. Friends, in addition to that, we do have a national overseas fellowships, scholarships. The students who are pursuing higher education or the professional courses abroad is promoted and provided all scholarships and fellowships to study overseas. We also have a credit facilities, that is subsidized credit facilities and also interest-free loans to make them entrepreneurs and also to make them self-reliant. Dear delegates, we do have a marriage allowances. The person with disabilities married to non-disabled person, we are providing about 2 lakh direct cash that is provided through bank account. So these are the direct cash transfers. And we do have a kind-based assistance programs, distribution of assistive devices. Many persons with disabilities require assistive devices to lead life with dignity and at par with the other persons. And we have a scheme called Assistance to Disabled Individual Persons for fitting and devices, assistive devices. We have a Atal Vayo Vandan Yojana where all elderly population who get assistive devices, including spectacles, wheelchair, dental kits, then many more. We have about 19 assistive devices which we are providing at free of cost. And we have a Samagra Shiksha Abhiyan program where all the students with disabilities are provided assistive devices to enable them to pursue their education without any barriers. And we have a national blindness eradication program where people with visual impairments are treated at free of cost in the hospitals and provided vision. And of course, we do have a national hearing impaired persons scheme where cochlear implants are provided so that they can lead normal life. Friends, we have a travel concessions to persons with disabilities. There is a 50% rebate or relaxation in the air travels, railways, and of course local transportation in the buses. We do have a tax rebates for the assistive devices, whereas general percentage of taxes is about 18%. When it comes to disabled assistive devices, it is hardly 5%. And of course, we are working on to reduce it furthermore and no tax in future. We do have a relaxations and concessions in the age and qualification for admission into education and also public employment. We relax the percentage of norms. And of course, free coaching and skilling for entrepreneurship and trainings. We do provide free coaching to the students who are aspiring to become a civil servant or who are aspiring to become a self-entrepreneur, or we want to become to develop entrepreneurship. Friends, as I mentioned, our Accessible India campaign is reaching and making all buildings accessible to the persons with disabilities and others. And promotion of skills and entrepreneurship among the persons with disabilities. We also have a grants program for purchase of assistive devices. Well, We have an institutional framework which is totally independent ministry that is called Ministry of Social Justice and Empowerment at the national level. We have departments for welfare of persons with disabilities at the provincial level, at the states level. Dear delegates, we do have a Chief Commissioner Persons with Disabilities and also state commissioners who monitor the implementation of all these laws, mandates, and ensure that they are delivered to the persons with disabilities and the needy people. We have national institutions for different types of disabilities. About 10 national institutes for providing trainings, doing research, providing guidance, and also providing rehabilitation therapies. As a extended hands, we have a composite regional centers across the country. And beyond that, we have a district disability rehabilitation centers at the district level. We also have a national trust for autism and other related disabilities. We do have a Rehabilitation Council of India that enables education system. National Finance and Development Corporation that provides credit facilities and financial assistance at the subsidized. Dear friends, we have an Artificial Limbs Manufacturing Corporation of India, which is the only public sector undertaking that provides assistive devices at free of cost to all eligible persons with disabilities. Friends, I would like to present this picture. This has a lot of meanings. You all know that we have landed on the moon. Friends, we are on the way to reach Sun under Aditya mission. And we successfully hosted the G20 leadership, and we have come up with a Delhi declaration that guided the entire global leaders how to lead it. The below picture that indicates we all need to join hands to make the rights real. With this, thank you so much for giving me this opportunity. Thank you, Alardi, for wonderful moderation. Thank you all.
Thank you all. And indeed, when we are talking about the package, we need to consider different diversity of the support. Cash transfer is really key. So when we say cash is not enough, that means we are not undermining at all the role of the cash, but we need also to think about the services. So that include human support services, and we also the concession as we saw. However, as social protection is not directly linked or should support, or should work on accessibility measures, still accessibility reduce the disability-related cost, which on another, which in a way or another, reduce the burden on persons with disabilities and reduce the support that they required. Generally, there is a remaining question, which is the role of organization of persons with disabilities in these processes. We are talking about disability-related costs, packages, designing, assessment, and so on. We need to have a truly disability-inclusive social protection to feature persons with disabilities through their representative organization in this process. To answer this question, I will go to Fatunu. Fatunu, if you can just quickly share with us your perspective and your experience in Samoa. Thank you.
Good afternoon. As a representative of organizations of persons with disabilities, let me begin by acknowledging the efforts by our governments in investing in making social protections programs inclusive of persons with disabilities. We are witnessing a lot of progress and at the same time, a lot of rooms for improvement. Social protection is indeed a precondition for inclusion of persons with disabilities in all aspects of society. On that note, I believe this is also an opportunity for us to acknowledge, celebrate the critical role of organizations of persons with disabilities to engage in, influence, create awareness at all levels, and ensure that social protection mechanisms are inclusive of persons with disabilities. So allow me to briefly share with you how we have been engaged as the OPD in the development of Samoa's first social protection mechanism for persons with disabilities. Discussions on inclusive social protection for persons with disabilities started back in 2020 when a disability reference group was established comprised of 6 persons with diverse disabilities by the disability sector and was tasked to contribute in the development of the social protection program and also provide support to government through the large social protection program for Samoa. Such mandate is significant to us because we are the only people who understand the needs of persons with disabilities and the level of support that is required. So the frame of our advocacy was based on 3 key principles. First of all, consultation with our members. All discussions that were happened at the national level, we took it back to the members, ensuring that their priorities are reflected, making sure that we remind government and our partners to consider the existing data that we have, making sure that we are part of the identification and data management process. We did not underestimate the value of capacity building. So through this, we communicated and reached out to the Pacific Disability Forum and Alex, of course, who then provided us with capacity building activities to ensure that whatever we are doing and however we contribute to the government are based on nothing but facts. So through these activities, there were 2 critical things that we worked on. First of all, the development of a comprehensive package included of a 100 tala cash allowance, a provision for assistive devices, a provision for caregivers, and of course, a medical scheme. This is to say that having a cash allowance is not enough when we talk about and when we try to ensure inclusive for persons with disabilities, because we will see, and it is not a one-size-fits-all approach. So as a successful result of this, we presented this package with a disability eligibility assessment to the government through the Social Protection Steering Committee. And of course, this was then taken on by the government of today after the election of 2021. Lastly but not the least, influencing legislations. Very soon, our government will be passing an amendment to the National Provident Fund Legislation 2023 with the intention that such amendment will help regulate the rollout of the cash allowance and any other provisions of the social protection mechanism. We have written a proposal, and on the proposal we were trying to highlight that, 1, having a medical certificate is not the only way and should not be the only way to have someone eligible for the disability allowance. 2, ensuring that we play a critical role in the identification of persons with disabilities and in the data management system. Ladies and gentlemen, these actions are critical, challenging, but not impossible. Let me conclude by saying that I reaffirm the commitments of organizations of persons with disabilities to contribute, change, and advocate to ensure inclusive social protection, and we accept the same from our dear governments. As it is only then that we realize and uphold the principles of no one left behind and nothing about us without us. I thank you.
Thank you so much. From my current job at the International Disability Alliance, which is a global alliance of organizations of persons with disabilities, I could share across the globe, organizations of persons with disabilities have been working and engaging in the social protection in the last years, including influencing, advocacy, data sharing, and so on. And there is a level of readiness to continue that effort from their perspective. So while we are going to the end, and we are almost there with the time, but still I would like to take maybe 2 or maximum 3 quick questions that is really burning questions. So, so we can hear from you as you hear from us as well. So anyone has a very burning, yes, please.
Thank you very much. Thank you very much. First of all, thank you all the panelists and the moderator. I have both question and observation. Not all disability can be seen or spoken. That's the first thing. Second thing, I observed one thing in the Philippines that I really admired.
If you can speak to the microphone, because
yes,
we didn't get the first question.
On the train, that you have a dedicated 1/3 of the, I don't know, called bogie, that is for the disability and the women and the children, and there's a kind of like cover with the cloth, which we do not have, like dedicated section, and 20% discount for taxi for people with disabilities. So that's the point. But the points that I'm trying to get to is that for social protection, for example, one example that I had to work and bring the students in my social protection course to Bangkok School for the Blind. It's the first school in Southeast Asia. And in Thailand, where you believe that we have universal disability allowance, there are 2 schools that are funded by government. And the rest, approximately 14 to 15, pardon me if I'm not accurate, but 7 times more are funded by foundation, individual donors who walk in and, you know, they want to do charity on their birthdays, and elites who run the school, who bring all the fundings in. So back to, from there, how do you encourage people in private sectors, and if we have private sectors today, to employ people with disability? Should we focus on the payment? Because some companies in Thailand, they can pay a certain amount and do not need to hire them, so they don't have to build toilets, ramps, so and so. Or should we use tax break or reduction? Okay? And last point is that, back to the first point that I mentioned, there are people...
If you can be as short as you can.
Okay,
yes.
All right, sure. There are people who had special needs, who are gifted, and they are not employed. And they can help climate change. They can help you recycle the vending machine better than just people like us, because they have ability to hold the texture of the cups and tell this is clear, or the clear or unclear bottles and cups. But there are no people interested in hiring them, because there are no such business model. And we presented in our symposium, and we want to model it by having the keynote, who is people with disability. So such thing, back to you for your views and points or answer. Thank you very much.
Thank you so much. Any other burning question? We have one in the chat. Let's see if you can read it to us. Actually, 2.
Thank you. The first question in the chat, CA is a new disability type in the Philippines. How can organizations like you promote awareness of this disability in support of the social protection of active cancer patients and cancer survivors? The second question, does the Does the SRDIM also assess and confirm disability status for children?
Thank you so much. So let us start with the closest one, Aldari. So, yeah, I can give you the microphone.
On the question on how are we engaging the private sector, especially in terms of employing persons with disability. Actually, in the Philippines, we have a policy that they should be able to hire a certain percentage. But of course, we're having difficulties of observing our compliance to the policy. But right now, I think there's an ongoing, of course, we do not stop advocacy and dialogues, but of course, there should be we also provide an incentive structure, a mechanism for private organizations or private organizations to actually have for them to really implement the law. And then on the, can you please repeat on the cancer? The CA has been, it has been included as one of type of disability. What's the, okay, let me, okay. Okay, so of course we're the DSWD, Department of Social Welfare and Development, is of course the primary agency in the Philippines that is leading the implementation of social protection programs in the country. And I think what the session is this session has already actually highlighted one of the issues that we have is in the Philippines is that the determination, right? How can we help them access the services that are already available, and of course making the access available. So of course, there are already several types of social assistance programs in the Philippines, and the challenge is, of course, we cannot. Sometimes the data doesn't tell us. It's not disaggregated. If there's if our beneficiaries have certain disabilities. So I think data really is database management, and of course is one important key element in if we want to really be inclusive in delivering social protection. So we would not be excluding, but rather designing programs that are really responsive to the different needs of our beneficiaries.
Thank you so much. So, Resimi, you have a question about disability assessment?
So the question asks whether the mechanism, the social right-based identification mechanism, also identify children. I would say yes, but not to the all extent. I think the identification starts when the children is 8 years old. I mean, that's from the expert, that's when we can identify the children. But I believe that those who are born with disability could classify or identify right away. So I would keep my answer short here because the question is very specific. So I don't have anything else to elaborate on that. Thank you.
Thank you so much. So, Mirego, if you have last intervention in 30 seconds.
Yeah, well, hope I'm audible.
Microphone.
Yeah. First, I'll come to the question directly, how to encourage private sector. Some nations, they are providing relaxation, tax rebates, concessions, and also providing basic infrastructure facilities as part of their industry promotion activities. That rebate is provided. And second thing, there are some countries which are implementing corporate social responsibility. As part of corporate social responsibilities, there are two types of provisioning is made. We in India, one is 2% of their profit has to be spent for the weaker sections, including the disability and health. That is the one mandate. The other is providing skilling, entrepreneurship, training as part of their corporate social responsibility, and also providing them employment opportunities so that they get absorbed into the private sector, private corporates. So these are the provisions which are being adapted in India, and of course they're following strictly. And the second question is cancer affected persons, creating awareness. Cancer is yet to be included as one of the type of disability in India, but maybe some other countries might have included. But creating awareness, again, it's a matter of, again, the responsibility of the Department of Empowerment of Persons with Disabilities, and of course as well as the health departments. So that there, of course, we are working more. There are organizations which are built and set up to meet the requirements of the cancer-affected persons. So I hope I'm satisfied with my
Thank you
my
so
answer.
much. So yeah, I will just quickly answer some points. When it comes to social protection, generally we identify persons with disabilities according to the category that is already stated in the law. So if the law says that persons with disabilities are those and those and those, we cannot go beyond that unless we change the law itself. Secondly, I would like to say about private sector and charity support to social protection. Generally, everyone here doing social protection at personal level in a way or another. We are all supporting our families, we are all receiving support, so we cannot say no. But on another hand, we cannot say we need to get back to the charity approach of having persons with disabilities supported like that. So we need to be careful on maybe having more formal institutional approach to such contribution and so on. About work and employment for persons with disabilities, indeed, persons with disabilities work, face stigma, discrimination, and lack of support to practice work. So just on another hand, we need to acknowledge the diversity among persons with disabilities and the diversity of the barriers that they are living in. So we need to consider such factors in mind when we are doing our intervention to see what should work well in such context, indeed in consultation with persons with disabilities themselves. By this, I will say thanks. Thank you so much, my guest here, for your valuable intervention. And indeed, the discussion now is different comparing with some years ago. We are talking about how we can provide further support, how we can engage persons with disabilities further, how we can do the things in line with the human rights-based approach. So you see, everything is how, and whenever we go, we'll have more how and more question, but this is the life, and this is why we are here to discuss together and share from each other and listen to each other to go forward. Thank you so much, and wish you all the best.